I welcome everybody, and thanks, Nupur. You will serve as the master of the ceremony today, and we'll keep going. Happy New Year to everybody, and hopefully this is the last year of the pandemic. I know everybody's struggling through this, and I'm hoping that the 2022 ASN will actually have a live event and have the samosas and chai and everything that we usually have at the ASN for the awards. I think I just wanted to highlight that the last year, despite the pandemic, we had some great increase in our membership. We had some nice talks with ISN, with our partnership. We also are now 501c3, and I think Amit will talk a little bit about that. We had a nice session with the GFR for South Asians in the middle of the year. And now we're here with the award ceremony. So we had a very fun-filled year with a lot of work still ahead of us to make this organization even better and bigger. With that being said, next slide. I want to congratulate our 3 special nephrologists that are being honored today. And, Nupur will take us through that as we finish some of the introductory parts. I still, please, everybody mute your, I'm still hearing some background noise. Thank you. Congrats to Rajan, Girish, and Vikas on this amazing occasion. And we'll take it one by one. We'll start with Vikas first. So before we do that, I just wanted to, give a shout out to our ANIO-Governing Body. These are our governing body members, and Ajay and Kabir, who actually formed the initial ANIO many years ago. Again, please mute your slides, please. Archana, can you mute? Thank you. These are our governing body members, and some of them have actually joined today, and thank you for that. They do guide us in our decisions with what we do with ANIO. Next slide. And this is our current executive committee, and this year and last year's program chair, Nupur, our past president, Prabir, our vice president treasurer, Amit, and Suchi, who serves as the ANIO ISN liaison, and also membership director. So thank you for all the work you guys did throughout the last 2 years. And there will be a turnover this year, and we'll have a new program chair and continue to move on to have new diversity in our membership and our leadership. Next slide. And I really want to thank Vandana and her team, Nisha, Geeta, and Madhu, to be this year's awards committee. They actually the ones who got all the award recipient CVs and made the final decision who would receive the award. So completely independent from us, this was their decisions, and I congratulate them on amazing choices for this year's awards. Well, thank you to the awards committee and led by Vandana.
Moving to the next award, we have the next award for service excellence, and the ANIO 2021 Award for Service Excellence goes to Dr. Rajan Ravichandran, who is currently the director of Madras Institute of Technology, International Director of Nephrology, Chennai, and also an adjunct professor at IIT Madras. And to give him an introduction, I would invite Dr. Paduranga Rao from University of Michigan to kindly give him a toast. Thank you. I can move your slides, Dr. Rao, if you want.
Yeah, I think that'll be fine. I think I just noticed 1 or 2 spelling errors, but I think that's okay. Hopefully people won't notice.
Okay.
Good evening, everybody. Thank you for this extending this privilege to me to introduce Rajan Ravichandran. He's known as Ravi to all of us. To toast him for being the 2021 recipient of the ANIO Award for Service Excellence. I cannot think of a more fitting award to a more appropriate person to get this award. I have known Ravi for a very, very long time. he was the first person I worked with after finishing my residency in Chennai. And this was more than 3 decades ago. So if you can start this, I'm currently a nephrologist at the University of Michigan. And for the next few minutes, I will tell you a few things about Ravi, about his background, and so that you get to know him. Knowing that Ravi has just landed in Madras, hopefully an index of how interesting I'm talking would be if you don't hear him snoring, because I'm sure he's jet lagged. So currently, as he was introduced, he is the director of nephrology at the MIOT hospitals in Chennai. He has his own unit there. There's a very active transplant program there, a very busy center for kidney disease. But more importantly, what's relevant to his current award is that he's the founder and the chair for the Sapiens Health Foundation in India, and also the founder and chair for the Cystinosis Foundation in India. Particularly relevant when I show you the next few slides about the impact these organizations under his leadership have had on kidney disease in India. Next slide, please. So just a brief background about his professional journey, because that's an integral part about what he has been able to achieve. So he did his medical education in Bombay. He was at KM Hospital. And he did his nephrology training in Bombay under Vidya Acharya. And subsequent to his completion of his nephrology training, he moved to Chennai, and he came to Apollo Hospital and worked under Dr. M.K. Mani as a senior registrar there. Some of the things that he has told me about his work when he was at Apollo Hospital would have definitely got, if it was under current ACGME rules, would have got Apollo citation almost every other day, because he was on call every other day, apparently. But nonetheless, he remembers very fondly his time there under Dr. Mani, and how he honed his nephrology skills. He subsequently went on to establish his own practice in Chennai. And initially, for a decade and a half, he was the director of the Madras Institute of Nephrology at Vijaya Hospitals, and that's where I worked under him. And then went on to become the director at the MIOT hospitals, where he's still the director, actively practicing nephrology. Next slides, please. Ravi clearly was a star in terms of in his academic prowess. This is one of the pictures I managed to get from him, in which he is seen here getting the university gold medal for standing first in medicine at the Bombay University when he was finally a medical student. He has had many more accolades to his credit, and it all shows in the work that he is doing. Next slide. This is during his younger days when he started his practice at the Madras Institute of Nephrology. He had patients from far and wide, from all across India, actually. A substantial portion of his patients were from the Northeast. And the word of his excellent care spread far and wide. And the hospital and this unit was constantly choked with patients seeking care from him. Next slide. But this is about his service award. And I have to tell you about all the things that he has done, which makes him the most appropriate recipient of this award. So he founded the Sapien Foundation, established in 1997. It was started with grassroots support from patients, transplant patients actually, who donated money for supporting patients on dialysis and for giving transplant medications, which obviously were very expensive for many of them. So that is the root of the Sapien Foundation, for which Ravi was the chairman and the director. But gradually, the scope of this foundation increased, and the prescient nephrologist that Ravi is, he realized very early on, way before preventive nephrology actually became a buzzword, Ravi actually honed on preventive nephrology by first starting a series of kidney disease awareness talks, which he gave all across India. And he also did not stop with just trying to educate the professionals. He reached out to the masses. He reached out to the people, and actually started a bunch of kidney awareness programs. And one of the things which it transitioned to, as nephrologists, we are all aware of the importance of salt reduction and the role of salt in kidney disease progression. So he started this campaign to reduce salt intake. And he did this via a variety of innovative techniques. And it included walkathons. It included using popular public figures for production of skits, which were enormously popular with the general public, creation of short movies, as well as delivery of kidney education to school and college students. This reduction of salt focus has resulted in a very positive interaction with about 300 food manufacturers to reduce salt in processed food. This is indeed a fantastic achievement. Very important because as a nephrologist, we are able to influence the disease of one patient, whereas with what he's doing right now, it influences the outcome of thousands of people who may not even be aware of the risk of kidney disease they have. Next slide. This is in the early years when he started his salt campaign, very catchily titled as Salt Sathyagraha. This was a walkathon which he organized at the Marina Beach in March of 2010 to spread awareness, public awareness of moderating salt intake and the dangers of excessive salt. So you can see a very young Ravi in his shorts and a hat. They're walking along with the rest of the folks, spreading the message of decreasing salt intake as a road to health. Next. This is another very unique, innovative program which the Sapiens Foundation under his leadership actually initiated. He conducted a survey of college students, about 2,400 students. And one of the innovative aspect of this survey was that he actually distributed home detection kit for the detection of glucose and albumin in urine, just with a simple, dipstick and a color chart being sent to the patient, sent to the college student's home, along with a container for collection of urine. And they bring back the results. And with this screening, he also published these results, noted an astonishing number of college students having evidence of albuminuria, which they were not aware of, as well as obesity, as well as hypertension. So this is really a fantastic grassroots effort at primary prevention of a lot of risk factors which lead to kidney disease, and a very, very innovative way of approaching this issue. Next. This is one of the things I was talking about spreading the message by means of short skits. So he approached a lot of the Tamil film actors, as well as people who come in TV shows, and asked for the participation in these street kits, which emphasize the value of detection of kidney disease, emphasize the value of following a healthy diet, emphasize the value of screening for hypertension. And these were enormously popular in spreading the message of preventive nephrology. Next. One of the highlights of the salt reduction program, which Ravi had started, was hosting the conference on salt awareness in 2017. He did this in association with the Indian Institute of Technology of Madras and Bombay. And they had this very well publicized conference, which included, a guest appearance by the WHO's Soumya Swaminathan, whom you see there in the picture. There was a lot of discussion, a lot of things which came out of this conference in terms of strategies to even more reduce the salt intake in the population. Next. So that was a huge grassroots effort which Ravi started very, very long ago, and which he continues, which I'm sure would have a substantial impact on the kidney health of a large section of the population. But he also had his eyes on a very, not very focused part of kidney disease, which was in young children with cystinosis. So he established the Cystinosis Foundation of India, which he established in 2012. He's the chairman for that foundation. And the scope of the foundation was to provide education for this very rare disease, for this forgotten disease in India, and provide the resources to procure cysteamine not readily available in India. As you know, the drug is expensive, it's difficult to get, and patients who are afflicted with this disease frequently do not have the resources to know where to go for it, even if they have the financial wherewithal to get it. And so the Cystinosis Foundation fills this niche in terms of providing education about the disease, not only for the general public, but also to the physicians. And in addition, providing the resources to procure this drug for these children. Thus far, 31 children have been registered with this foundation, and the foundation has facilitated these children from to get this drug and to slow the progression of their disease. It's a remarkable achievement, given the fact that it is, first of all, very difficult to spread the message about the prevalence of this disease and the manifestations of this disease. And second, to actually start this whole process with all of the bureaucratic hurdles which you would face in actually procuring these drugs for these unfortunate children. Next. So this is the launch of the Cystinosis chapter in India in May of 2012. And you can see the little kids there with cystinosis who are the recipients of what the foundation has done for them in terms of procuring the medicines. And these are, sections of the society which do not have a huge amount of resources. So what Ravi does clearly is an outstanding work in terms of providing help to the section of society which most needs it and has the least resources to get it. I mentioned in the past in the SALT campaign how he very skillfully leveraged the enormous popularity of the film stars and of the actors and television series to popularize the message and to deliver it in a way that the public actually understands it and enjoys it and actually takes home a message. So on to the right of the screen, you will see the superstar Rajinikanth actually, who is part of this initiative which Ravi has initiated in terms of both the SALT message as well as the Cystinosis Foundation. It is an absolutely brilliant move, I think, which Ravi has done in terms of harnessing the enormous powers of the film stars who are like close to God in India in spreading his message. Just goes to the very sharp intellect and the very savvy which Ravi has in terms of how to deliver messages to the general public. Next. So that is all that he has done in terms of his service. I don't think any of you can disagree of the huge impact he has had and he's going to have in the future with all the things that he's doing with the Sapien Foundation as well as with the Cystinosis Foundation. But all of this would not be possible without the enormous support he has from his family. This is his wedding picture. You can see, he with this big garland and sitting next to his very beautiful wife, Lalita. This is at the time of his wedding. So next. And his lovely family, his two children, Kritika and Kanchana, who are there along with Lalita. They are currently in the United States. And Ravi has their support. Being a registrar at Apollo Hospital, you necessarily need to have the support of your wife. Otherwise, I think you would be out in 2 days. So clearly, he has enormous family support, a very loving family who are with him every step of the way in this wonderful journey he has launched to improve the kidney health of a majority population in India. So it is my great pleasure to actually commend Ravi for getting this award. I can't think of a better person who should get this award. I want to complete my commemoration of Ravi with this quotation: "The best way to find yourself is to lose yourself in the service of others," by Mahatma Gandhi. And I think Ravi truly has taken this as his call in terms of providing service. Thank you. Congratulations, Ravi.